Hello, everyone. Thank you so much for joining today's Wednesday webinar. As always, we're going to give it just a couple minutes to allow the room to fill up before we go ahead and kick off. All right, we'll give it just one more moment before we go ahead and get started. All right, good afternoon, everyone. Thank you for joining us once again for our weekly Wednesday webinar series. Today's webinar is on the National Research Blueprint, a continued conversation. If you joined us last week, you heard a little bit more about it, so we're going to continue the conversation today. My name is Esmeralda, and I am the moderator of this series. At any point during the webinar, if you would like to ask a question, please use the Q&A feature at the bottom of your screen. If you're joining us from one of our live streaming platforms, as always, you can drop your questions into the comments. We have NHF staff members monitoring these questions, which we will post to our presenters at the end of their presentation. This webinar is being recorded and will be available to the community beginning on Friday, March 31st. It is our last webinar of March. We are quickly wrapping up Bleeding Disorders Awareness Month, so I think this conversation is super timely. I am joined today by Mike Recht, the Chief Medical Officer, our new Chief Medical Officer here at NHF, and two lived experience experts, Sammy Valdez and Esmeralda Vasquez. Thank you for taking the time to join us today. I will go ahead and turn it over to you to get us started.
Well, thank you, Alison, and thanks for joining us also, Sammy and Esmeralda. My name is Mike Recht. As Alison said, I'm the new Chief Medical and Scientific Officer at NHF, where I will be responsible for working with Maria Santaella and the incredible NHF team, as well as multiple consultants to complete the inherited bleeding disorder community's national research blueprint. In addition, I'm a pediatric hematologist and professor of clinical pediatrics at Yale University School of Medicine, where I see children and adolescents and young adults through the Yale Center for Bleeding and Clotting Disorders. Last week, I presented all the work that went into getting us to where we are today with the National Research Blueprint. Today, I'll be presenting with Esmeralda and Sammy, who are two of the chairs of the Lived Experience Expert Working Group, to give you an update of what has been accomplished with the National Research Blueprint process to date and where we expect things to go in the near future. Could I have the next slide, please? The inherited bleeding disorder community's national research blueprint stems from NHF's vision of a world without blood disorders. We know that such a world cannot be a possibility without robust, individual-centric, and equitable research. We also know that to accomplish this vision, we must work together to create positive change for today and for our future generations. When we think about research, we think about three different features: research approach, research process, and research outcomes. As part of the National Research Blueprint, we are reimagining how to prioritize and fund research that matters most to those impacted by inherited bleeding disorders. We are advocating for a significant change in our research process. We plan to reorient and democratize the research culture and structure to integrate the thoughts and input from all of those impacted by inherited bleeding disorders, a group of people who have identified themselves as our lived experience expert, or LEEs. Going forward, all research executed as part of the National Research Blueprint will have significant input from our lived experience expert community, from prioritizing what questions will be asked to assisting in designing research that is feasible and impactful in this post-COVID world, to assisting in disseminating results from our research projects. In addition, only by working together with our lived experience experts will we be able to appropriately apply our research outcomes to make research progress faster and of the highest possible quality to positively influence the lives of those impacted by inherited bleeding disorders. Next slide, please. So we've been at this for almost 3 years since Dr. Valentino came to the NHF as president and CEO. The whole process started by listening to those impacted by inherited bleeding disorders, providers, payers, government partners, industry representatives, local leaders, and elected leaders. Since September 2021, we had the virtual State of the Science Summit. This summit was the culmination of over a year of work by scores of people who gave their thoughts about what the most important research priorities were for those impacted by inherited bleeding disorders. 6 working groups were formed and reported on research priorities for those with hemophilia, those with von Willebrand's disease, platelet disorders and other mucocutaneous inherited bleeding disorders, those with rare inherited bleeding disorders, and those who are women and girls and people with the potential to menstruate. All research priorities were couched in the idea that diversity, equity, and inclusion were tantamount. This work helped us define our research priorities by assessing the feasibility, impact, and risk of each potential project. The National Research Blueprint Working Groups were formed in 2022 and have been working to design this next phase of the project. All the NRB working groups have been charged with understanding what the community needs from research to help get to the world without inherited bleeding disorders. To that end, the manuscripts from each of the working groups from the SOS were just published in a special supplement of the journal, Expert Review of Hematology. In this supplement, each working group outlined their key research priorities for inherited bleeding disorders. Embedded in each summary was a special summary aimed towards our lived experience experts. In addition, we sought international perspectives to determine how the blueprint being built for the United States could potentially be generalized to other areas in the world. These recommendations are the basis on which the National Research Blueprint is being built. Please go to the Expert Review of Hematology website to look at these papers. They are available for everybody. And in particular, please take time to read the paper by Esmerelda and Michelle Kim and Maria Santayala, describing how the group of lived experience experts participated in the State of the Science and the role they are playing in the National Research Blueprint. This paper is as inspiring as anything I have read in a long time. Next slide, please. These papers represent the basis for a clear and actionable National Research Blueprint. Methodical processes were taken to ensure the recommendations were well-grounded in clear unmet needs and in under-addressed challenges. As I previously discussed, each of the research priorities were assessed for their feasibility, their risk of failure, and the potential impact to positively influence the lives of those with inherited bleeding disorders. The conclusions of each of the working groups offered defined specific steps to make progress in each of the focus areas. Most importantly, these recommendations reflect the interests and desires of our community. The combined conclusion reflects years of community dialogue and debate. They are all grounded in principles of social justice, diversity, equity, and inclusion. And there was deep integration of lived experience experts throughout the entire process, supporting the most realistic applicability of research priorities to address care for previously excluded populations. Next slide. So let's take a more granular look at the manuscript by reviewing at a high level the recommendations made by each. Starting with the hemophilia working group, this group focused on building on the considerable progress in treating hemophilia, with the research now shifting towards improved diagnostic and testing, curative strategies, and advancing health equity. Key themes raised to advance research included opportunities to better understand and manage other conditions experienced by people with hemophilia because of their hemophilia, with the goal of assisting people to thrive throughout their lifespan, searching for novel approaches for collaborative research and care delivery to foster health equity, harnessing technical advances to improve diagnostic testing, and focusing on psychosocial and quality of life outcomes to define new standards of care. Next slide. Members of the Mutualcutaneous Bleeding Working Group, and this includes von Willebrand's disease and platelet disorders, made recommendations around research into these conditions. They supported the idea of collaborative research to improve diagnosis and management of these sometimes poorly understood conditions, with the goal of reducing the impact on an individual's quality of life. Key themes included improving the understanding of the basic biology of these disorders, simplifying and shortening the diagnostic journey of people with these conditions, understanding the natural history of living with these conditions, including multidisciplinary, cross-specialty, and international collaboration, all leading to creative approaches to novel therapies. Next slide, please. The ultra-rare bleeding disorders working group focused on opportunities to improve diagnosis and treatment through studies leveraging collaborative research networks and infrastructures. Are you seeing a pattern in these recommendations? The key theme raised by the ultra-rare bleeding disorders working group, including connecting primary care providers to specialized expertise, formalizing and supporting a national network for advanced diagnosis, enhancing the research infrastructure in order to collect more robust and high-quality data collection, improving the regulatory process for novel therapies, and facilitating national and international research collaboration. Next slide. The working group advocating to advance the health of women, girls, and people with the potential to menstruate who are living with bleeding disorders focused on the fact that there remains a poor understanding of normal compared to abnormal bleeding, leading to inequities of care. Key themes raised by this group included having a better understanding of the prevalence of inherited bleeding disorders and how they impact this population, defining what can be defined as normal in regard to treatments in this population, establishing new methods to better quantify bleeding in people who menstruate, along with widespread dissemination once a better method is established, and identifying individual important outcomes of the greatest importance. Next slide. We tasked one working group with the gargantuan task of developing research priorities in health service delivery, diversity, equity, inclusion, as well as implementation science. They stress that considerable gaps must be addressed to improve healthcare delivery and equitable access to state-of-the-art care for all people with inherited bleeding disorders. Their recommendations included research into how telehealth, behavioral and mental health, and pain management services impact access to care and outcomes, as well as systems-based solutions to address entrenched racism, divergent lived experience, both conscious and unconscious bias, as well as inclusion of all in data collection and education. Finally, they supported the idea of integrating implementation science, or the study of methods and strategies facilitating the collection of evidence-based research into clinical study design. Next slide. We had a working group focused on facilitating research through building an appropriate infrastructure and workforce. The members of this working group clearly communicated the fact that accelerating inherited bleeding disorders research requires focused investments in both people and systems to foster collaborative networks. The key themes coming from this working group included the idea that anything built must enable research into all inherited bleeding disorders, both within and external to the Hemophilia Treatment Center network. That the workforce must be both diverse and sustainable, and funding for innovative research networks and innovative clinical trial design is intrinsic to the success of all other recommendations. Next slide. At this point, I'd like to pass the slides off to Esmeralda and Sammy, the two of the chairs of our lived experience expert working group, to talk about their journey through the process. Esmeralda and Sammy.
Great. Thank you, Mike. So Michelle, the other co-author of this editorial, and I really wanted a space where we could highlight and really amplify our voice. And our goal was to let the reader understand that our unique real life knowledge of how our bleeding disorders impact physical, psychosocial, the social emotional well-being can help guide research. I mean, truly, this really makes us experts. And if we think about participation and what participation means in research, participation is based on this belief that those who are affected by a decision have a right to be involved in that decision-making process. So that was kind of like our ultimate focus of this editorial. And then we also kind of detail our journey and how the evolution came from the term subject matter expert to lived experience expert. And we consider lived experience experts anybody living with a bleeding disorder and all their caregivers, all their support system who helps guide them. And I'll explain this a little bit more in another slide, how this evolution came about. And the three main key themes that rose from this paper was that participation in research can be progressive in a continuum. There's truly something for everybody based on their comfort level. And Sammy will go ahead and explain this continuum in a little bit more detail. The second theme is that research leadership. I mean, we truly want to be recognized as shared decision makers. We want to be involved in all different, in every single step of the research process. We have a role to play, we have expertise to bring to the table, and we really want to be more involved in this leadership and this decision making. And then the last theme that rose is the empowerment of LLE participation and how we can participate in educational programming, how we can be more engaged, and how we can help address some of the barriers for participation in research. And at the very conclusion of our talk, we'll highlight some of the things that our working group has been working on. Next slide, please. So my journey and my story begins at an HTC center. When I was a child, I was in a pediatric HTC center, and my father was very involved in research. I mean, he was very passionate and believed in science. And if there was an opportunity and if he was invited to participate in a research study, he would enroll me in those trials. I grew out of that HTC center, but I took those values with me, and I knew how important research was. I got lost in the healthcare system for a little bit, and then I found my way back into an adult HTC center. And my participation in research has always been, up to this point, you know, I go see my doctor, I get invited to participate in a research, I read the consent form, I sign, extend my arm, they draw my blood, and that has pretty much been the extent of it. And I have always been very happy with this. I didn't know there was much more than I can do. I never realized what the results were of the research study, nothing was ever communicated back to me, but I was always very happy to participate. Then about 3 years ago, I was invited to be part of the State of the Science Steering Committee. And that really kind of opened my eyes and helped me see research in a different light. One, how complex it really is, and all the moving parts that occur on research. But I was just very glad to be part of it, very appreciative that I can have an opportunity to kind of speak my voice and provide some input. Then I was invited to a panel, and I think I made some remarks that really kind of resonated with some individuals. And I was asked to be a part of the National Research Blueprint, which is what I've been working on for the past year. Also, again, it helped, again, continue to help me understand research at a different light, and really realize, like, hey, we can play a part of research at any level. Trust me when I say that there's opportunities for everyone, depending on your comfort level. And more recently, I, along with Sammy and Aaron, am one of the co-chairs of the working group. And it's a group led by LEEs, and also all our members are LEs. And together we kind of make decision of how we want our voice integrated at every single step of the research process. So it's been very life-changing, and it has helped me really appreciate even research even more. And when I talked to my dad, and I was like, there's so many things we can do, Dad. Like and he's so happy to read the editorials and the plain language summaries that he can understand. And it's just truly life-changing. And I'm so grateful to have these opportunities. Next slide, please. And I'm gonna hand it over to Sammy so she can share with you her journey and her story.
Hi, so my story is a little different than Esmeralda's, is that I came into the bleeding disorder community when my daughter, my oldest daughter, was starting her menses and having issues with them. And we found out that she had factor 7 and von Willebrand's disease. And we had no idea what that was up until that point. So it was a very scary journey at that moment for us. And then the rest of the family got tested, and my other daughter and I both have von Willebrand's disease. So my oldest is the only one with factor 7. And at that time at our HTC clinic, my daughter was the only factor 7. And she is one of, I think it's only 1,000. It may be more now with technology, but to have both bleeding disorders at the same time. So, so we started our journey there. And like Esmeralda, we always were key to say yes to research when they brought in the paper, sign it, take the blood draw. And us too, we're always like, well, what's happening? What's going on? Where did that end up? Where are we in the process? You know, nothing really ever came of it. And then when the SOS came out, I was asked to be on a behind the scenes, and you see in my photo there, that was my group. We met virtually and went over the state of the science, asked questions, answered questions. We would watch the videos and then come back together. And then we were asked to come to a meeting for the state of the science in Washington, D.C. So we came together and did that. It was pretty much round table-ish. You sat at a table and they presented to us, and then they asked at the end of that who would be interested in being in working groups. So I obviously volunteered for that, and then probably a month into that volunteered to be a co-chair. But I love it, and I love seeing how much science is changing and how we get to change that, and how our journey from SME has gone to LEEs, and how we've had this whole vision of things that we're just so excited about and so happy. But most of all, we're excited to empower patients like you to understand research and be a LEE. And I think we're ready for the next slide, and back to Esmeralda.
Right, thank you. So we were initially given the title of subject matter expert. And I felt like initially it was a title that was representative of our role. I mean, I consider myself an expert, as equally as maybe a physician or a researcher. I'm an expert on my own lived experience. But in our group discussions, what we were realizing is that the SME term was starting to be very controversial. Not everybody recognized us as subject matter experts, and we didn't want to always have to explain and justify who we were and why we were at the table. So our group kind of, in one of the meetings, we kind of suggested different titles. And at the end, we all kind of voted and we agreed on the lived experience expert. Is a title it's very clear. It defines who we are, and we never have to fight for our credibility. And I feel like this was really like a turning point in our participation. And it was definitely a point where we felt more empowered. And when we began to kind of create our own identity, it was a name that was created by us. It's for us. We are all in agreement. We embrace it. And we're kind of taking it to a different level and even kind of creating a little logo. Sammy's really excited about the logo. We are creating something a symbol that'll create our voice. So anything that our input is provided, we will have like a little logo with our lived experience sign. It's our identity and we're embracing it. And I feel like it's extremely empowering. It represents who we are. It's something that wasn't given to us. It's something that we on our own came up with. Sammy, I'm not sure if there's something you want to add to this, because I know you were also very excited about this.
We also use the term everything for us with us. That is our motto, or that we go by.
I mean, we feel that if there's going to be a decision that's going to affect us, there has to be some involvement at every single level. So that's a little slogan that we're really embracing too. Next slide, please. I'm going to hand it over to Sammy so she can kind of explain this nice continuum that kind of highlights how we can get involved in research.
Well, we start off as the human subjects in research, and then we went from the subject matter experts to the lived experience experts. We have input, we have consultation and collaboration and shared leadership. But the next slide shows the continuum more. So this is really where we see us going in this and having Lee's involvement. So you can be all in like we are, or you can be just a little in. Maybe you just want to do focus groups, or maybe you want to be a research ambassador. Maybe you want to join some committees. Maybe you want to be on an advisory panel. Maybe you want to be a co-principal investigators. So you don't always have to, when you sign up to be a Lee or anything, you don't necessarily have to be all in. You could be just a little in, you could be a little out. As Lees, we know that it's not your prime job to be so we want you to be able to fit it into your schedule and work around what you can, and to be an equal partner when you do come to the co-principal investigators and the advisory panels. We want you to be just as equal as the researchers are in that table forum. By doing this, you can get involved just a little bit, you get involved a lot, you can grow. Maybe right now at your stage of life, you just want to be a research ambassador, but maybe 4 years down the line, you want to be a co-principal investigator. There's going to be that option available, and there's going to be some training that goes along with that to help you be able to be on the same level as the researchers at the table. Did you have anything else, Esmeralda?
I think you pretty much covered it. I think we are still kind of in the process of creating different ways that we can get involved. Every time we have a meeting, I think about something new, a new idea. And I would love to hear from everybody too, if you guys have any suggestions on how we can get more involved in research. And like Sammy mentioned, it's very flexible, and we understand life commitments and family commitments that occur. But trust me, there's something for everybody. And perhaps like we start in the very beginning and move along the continuum as you feel more empowered and your confidence increases. Maybe some of you are already leaders and principal investigators. That's great. But we want to make sure that this opportunity is really accessible for everybody, because we really want to get the community engaged, and we want a very robust and diverse LEE group from all throughout the US. Everybody's lived experience is very different. I mean, Sammy and I kind of talk about how different we are, and we have so many things in common, but our lived experience ultimately is very different. So the more voices we have, our voice will be much louder. So we want to encourage as many people to kind of join in on our mission. I call it this movement that's happening. And the more power we have, the more change we can make. Next slide, please.
So I think it's my turn again, and I really want to thank Esmeralda and Sammy. Those last two slides demonstrating the evolution and the differing levels of opportunity within what we're planning as part of the National Research Blueprint. I saw those for the first time this morning, and those slides are really dense. So I'm going to have to dig into those a little bit. I think they really are a good representation of what we're trying to think about as we roll out this entire project. So again, I want to recommend anyone listening in on today's webinar to go to the Expert Review of Hematology website to read Esmeralda's paper. It really is inspiring. And I can't wait to see that new logo. Throughout this process, we've come up with a set of recommendations, transforming ideas and unmet needs into tangible, feasible, and direct guidance on how to create the next generation of research and researchers. If I had to summarize the 3 common threads between the working groups, I would say the idea of speeding research through design of appropriate research infrastructure, resetting the idea of what is acceptable for those with a tendency to bleed, and simplifying diagnoses came through loud and clear. Next slide, please. By attending today's webinar, you are all demonstrating your continued enthusiasm to team with us to achieve this collective vision. We need our continued focus, energy, and commitment to the process, as we may never see this opportunity again. Our work continues to sharpen the blueprint, so be part of the conversation. Share, discuss, provide feedback, and connect with others. Finally, work with us as we seek funding and awareness and support for community building, enabling the activities of these priorities, the activation of these priorities. Next slide, please. To me, the most important takeaway from today's webinar is the fact that the National Research Blueprint for Inherited Bleeding Disorders must be activated and driven by a diverse, informed, and engaged bleeding disorders community of lived experience experts, as well as healthcare providers and researchers. All of this work is grounded in sound principles of equitable and inclusive access to care and research, fueled by strong advocacy, communications, funding, and policy progress. When we are successful, and you notice I say when, not if, when we are successful, I anticipate we will have faster progress to address unmet needs, gain novel insights from our gathered data, embrace the lived experience expert voice, build quickly on what we learn, accelerate the time from discovery to delivery to individuals impacted by bleeding disorders, more efficiently use our resources, and probably most importantly, learn as we move forward. Next slide. All this work has pointed us in the right direction. We have crossed the threshold for action. We are currently presented with an opportunity of a generation. If we don't do this right, we may not have a second chance. And we must act now, understanding both the importance and urgency of the situation. We're at a tipping point today. We have the necessary, critical, strategic, and inclusive momentum to achieve transformational progress. We have combined passion of clearly identified priorities, community engagement, and diverse commitment. We are in the middle of an incredible therapeutic progress in the treatment of people impacted by inherited bleeding disorders. And we have the research momentum to begin talking about cures. We will make this happen together. So that's all we have in terms of slides. We are now open for any questions that people might have. I really appreciate everybody attending today, and I look forward to a robust discussion.
Wonderful. So before we kick off the Q&A, I just want to give you guys again a reminder that nominations for Awards of Excellence are open through May 5th. You head to hemophilia.org/BDC. you'll want to go to the program tab and click on Awards of Excellence. From that page, you can click on the button for the nomination form. And as a reminder, again, self-nominations are not allowed at this time, but you can nominate somebody that you know that you think would be a great fit. Okay, I do have a couple questions, but if anybody else has anything else that they would like to ask, please go ahead and add it into the Q&A. And my first question is, what should I really know before becoming a LEE or an LEE? I'm sorry.
Well, I'm going to leave that to Esmeralda and Sammy. I think, no, I'm not going to answer. I will jump in and answer. Esmeralda and Sammy, I'd like to hear what your thoughts are of that.
So you don't have to know anything to be a LEE at this point, as long as you have a bleeding disorder and your lived experience is what makes you a LEE. So you already are a LEE. Now it's just a matter of joining the group and empowering yourself.
Right. There's really, I mean, I stepped into this role with really just with my bleeding disorder. I have Glansman's thrombasthenia, and I'm very vocal about more research in ultra rares. Maybe you can identify some of your areas of interest, some of your personality traits. Where do you kind of envision yourself? And like I mentioned, like there's something for everybody. There's a lot of flexibility, and I mean, I know this is a time commitment, but you can kind of also state how much you're willing to time. You'll get to work with other LEEs, and you'll get to work with some of the top researchers in the country, which is always very exciting to know that you're making change in that research process.
Fantastic. So if I want to join as an LEE with a minimal commitment, how do I present that during my application to participate?
Could you say that again? It cut out on my side, sorry.
Oh, I'm sorry. If I want to join as an LEE with a minimal commitment, how do I present that during my application process?
Okay, so right now there is kind of no formalized application process. What we're in the process of doing right now is kind of creating this document of how we want LEEs to be involved. And Mike, I'm not sure if you can speak to this, like eventually how this is going to be the implementation of the National Research Blueprint and getting the word out there. And then we would start kind of getting more of the community engagement part. We have so many different working groups working on community engagement, infrastructure, to see how all this will be implemented.
Right. Esmeralda and Sammy, could you remind me again the exact wording that used that was around nothing to us without us? What's the wording that you used exactly?
Nothing for us without us. Yeah.
Okay, great.
Everything for us, about us, or with us.
Okay.
Yeah.
We added like a nice positive spin to it, and it was nothing about us with us. And one of our group members was like, "How about we make it a little bit more positive, like everything about us with us?"
Yes. Yeah.
And then the other thing before Mike jumps in is there's no formal thing at this moment, because the working group is the working group, and we're just about done with wrapping that part up for the blueprint. This was all part of the blueprint. We've now created the movement to go forward. So I do know that we're going to be presenting at the BDC as well on a LEE group. And at that point, we're going to roll out like a Google form where you would sign up, and then we would have your information in a database. And as things came about, working groups or maybe a research project comes up that they're looking for LEEs or different things, then we'll take that information and distribute it out to those. But at this point, there is nothing really formal, but that is in the works.
Yeah. One of the working groups of the National Research Blueprint is called the Infrastructure Working Group. And the Infrastructure Working Group is tasked with coming up with the actual system of how we're going to make this collaborative research possible in the United States. And I've been working very closely with the Infrastructure Working Group. And what I can tell you is that each level, each process that is going to be proposed by the infrastructure working group, significant participation by LEEs, it will be available. And by significant, I mean like half of the people on the steering committee and half of the people helping design studies and half of the people deciding if this is a direction we want to go to or not with a particular study are going to be LEEs. So there will be lots of opportunities to be as involved or touching the process around the edge that you want.
Wonderful. So please describe specifically how women and girls with bleeding disorders, any factor level and phenotype, are going to be recruited to enroll in research.
I will grab this one. Is that okay, Sammy and Esmeralda? Yeah. So women and girls with bleeding disorders are one of the key populations that have been underserved up until now. So the working group that's looking into research and development, what questions we want to be asking for helping us prioritize the questions, the infrastructure working group, the workforce working group, right? Bringing women and girls into the actual research structure all have a priority of bringing women, girls, and those with the potential to menstruate into this process. It built into this question is the sort of this little sub part of the question about no matter what the factor level is. And that is exactly right. We want complete representation from this population, and we want to make sure that their needs are recognized and understood as we start asking a different type of research question.
Great. And then for my final question, I have, as a researcher, how can I participate in the National Research Blueprint?
Well, first of all, thank you for being interested in participating. When this National Research Blueprint working group step is completed, and we expect this to be sometime in early 2024, we will have either a virtual or in-person meeting to go over all the recommendations that are coming out. And it is at that step that we are really going to begin to be able to pressure test each one of these recommendations. And does the way we recommend how we set up the infrastructure, does it work for this population? You know, we're going to look for 1 or 2 or 3 projects that might be a little bit on the easier side, just to see if what everything we recommend actually works. And once that happens, we will have a process to participate actually in steering committees or evaluation committees, or propose your own research. So there'll be lots of different ways for people, both LEEs and researchers and clinicians, to participate in the entire process.
Wonderful. All right. Well, I would like to thank the 3 of you again for taking the time to join us this afternoon. We appreciate your time and expertise very much. And I would like to thank each one of our viewers for joining us as well. Please note that this recorded webinar will be available on Friday, March 31st at hemophilia.org under the Events tab with all of our archived webinars. Also available in the Events tab is our upcoming schedule for our weekly Wednesday webinar series. Thank you for joining us this afternoon. Have a wonderful week, and I will see you right back here next week as we continue on this series. Have a good one, everyone.
Thank you, everybody.
Thank you.